My role in the mental health community is really an advocate in the workplace and helping other workplaces be a mental health first aid instructor, a confidential person that they can come speak to, and for me to be able to bridge the gap to get them to the professional resources that many people require. Mental health for many years in our workplace was non-existent. We didn't speak about it. It wasn't something that was brought up in our occupational health and safety meetings. Unfortunately, we had a tragedy in 2009 that affected our workplace.
I've worked offshore for the past 25 years in the oil and gas industry. There was a helicopter accident, a crash that happened in 2009 off the coast of Newfoundland and Labrador, which affected me so profoundly.
And we found out after this tragedy that so many people were suffering, but we knew we had to do something. We came together and started a mental health and wellness program, being able to help people, being able to give people an avenue to come forward, to start conversations, to talk about some of their issues with themselves or even their family members, and be able to have a listing of resources to be able to get that person to the most appropriate professional help. Living 25 years on an installation in the middle of North Atlantic, I can tell you that 25 years ago, mental health wasn't spoken about there, as I've already said. In our communities as well, I feel that we've come so far. We still have a great ways to go, but we've come so far. When we start implementing workplace programs to different workplaces, I think there's a hesitancy is first. They may be hesitant to talk about mental health or to share. When I do a presentation, perhaps the first presentation, people are very quiet and they're guarded. But if you can unlock that, if you can share your own personal lived experience with people in a room, you unlock that and people start sharing themselves. And it's a very wonderful thing when you see so many people starting to share about their lived experiences, their strategies, their tools. Because if you're a good advocate or you're a good instructor, once you do that, the room teaches itself. Sometimes change takes a long time to happen. When I look at many workplaces right now, some are kicking the tires at mental health programs or are considering to bring it in as part of their workplace. And all I can say is I just encourage every workplace, no matter if they have 5 employees or 5,000 employees, to start implementing psychological safety and mental health in their workplace. Please, those companies that are out there that are just trying to decide if you're going to go ahead with a program, do it. It's a return on investment financially, but the investment that you get back with your workers is going to be something fantastic. Chosen as a champion of mental health and have my peers put in recommendations for me for this award. It's just so overwhelming. The word overwhelming just continues to come to mind, to know that the work that we have done, the work that we continue to do is being recognized by our peers. And that's just something so special.